Well, hello, everyone. Already I see so many familiar names. Thank you for joining us this afternoon for our virtual impact report session. I would first like to welcome AFJ Board of Directors President Wendy Hart, Ambassador Brenda Johnson, Ambassador Pamela Bridgewater, Ambassador Nick Perry, Denise Dubuque, Monica Ladd, Pat Falkenberg, Roddy Klotz, and Sarah Shaw. On behalf of my board of directors, I am delighted to welcome Dr. Christopher Tufton, Minister of Health and Wellness, grantee partners Jade Thomas, Mandy Melville, and Dr. Amoy Ramsey. Welcome Ambassador Curtis Ward, Dr. Camelia Lawrence, and Dr. Melody Ennis. The Virtual Impact Report event is a moment for us to pause and reflect on what your generosity and partnership have made possible over the past year. A year of Hurricane Beryl and ensuring our activities align with the goals of our donors, sponsors, and stakeholders. It is a chance to acknowledge the work ahead and the lives we are yet to reach together. You will hear how when children find their purpose, they're more positive and empowered. From education to healthcare, economic empowerment to emergency response, this year has shown us again and again what is possible when people who care come together for a shared purpose. At the heart of everything we do is our mission, which is to support Jamaican charitable organizations and social initiatives committed to sustainably transforming the lives of Jamaicans. Very powerful statement. This mission continues to evolve to meet urgent needs while remaining grounded in our long-term impact. And thanks to you, we're building on a strong foundation to expand in critical areas in the coming year. I am Karen Chung, the Executive Director of the American Friends of Jamaica.
Good afternoon. My name is Diamond Mosley, and I'm honored to serve as the Development Officer at the AFJ. I would first like to echo Karan's sentiments and thank each of you for being here, as you are not just contributors, but you are allies in our mission. Because of you, AFJ has been able to respond to urgent needs while investing in sustainable, long-term progress in Jamaica. I would love to share some of these key initiatives that your contributions have directly enabled. Over the past year, we have been able to deliver 56 programs and award 27 scholarships, supporting vulnerable communities and empowering students across the island. In the wake of Hurricane Beryl, your generosity helped us move quickly, and we provided relief to nearly 1,000 farmers and fishermen and supported the repairs of nearly 800 homes. That's hundreds of families who are now back on stable ground because of you. I am also thrilled to share that we have made an impact in nearly 10 of Jamaica's 14 parishes, and we are well on track to reach all parishes. In total, more than 18,000 people were directly served because of your investment. Every home repaired, every scholarship granted, and every life touched carries your imprint. As I grow into the role as development officer, I am especially looking forward to getting to know each of you. My goal is to not only sustain your generous support, but to build meaningful relationships, listen to your interests, and grow together as partners in this work. On behalf of the AFJ team and the communities that we serve, thank you again for standing with us. My colleague Pete Tagay will now share more details on your impact.
Good afternoon, everyone. I am the program analyst here at the AFJ. Our annual grants program is the core of what we do. We're strategic in our approach and our partnerships. In collaboration with the Jaja Foundation and the Ministry of Health and Wellness, a total of 50 butterfly devices were distributed to 19 hospitals across Jamaica. With over 100 physicians trained in their use. These devices will improve the quality of medical care for up to 90,000 patients per year. Along with the Colgate's Bright Smiles, Bright Futures, and the CariMed Group, 6 back-to-school dental clinics were coordinated across 3 parishes, providing essential dental care services to 348 children in need. In support of the Western Regional Health Authority's mission to reduce the incidence of blindness caused by diabetic retinopathy in patients through early detection and treatment, essential equipment, including retinal cameras and a laser machine to serve 4 parishes were acquired, allowing evaluations for over 3,000 patients and 500 laser surgeries annually. Education programs were administered at 26 program sites aimed at improving learning and development. We strengthened community well-being through 6 healthcare initiatives, enhancing essential medical services. We funded 2 dedicated programs ensuring foundational nutrition for healthy growth and awarded 27 scholarships to recipients at the University of the West Indies. These grants are strategic investments in human potential and community resilience. They allow us to amplify impact and demonstrate our unwavering dedication to Jamaica's brighter future. Our operations manager, Griffin Sabatini, will engage you with a few impact stories.
Hello, everyone, and thank you, Peter Gay. My name is Griffin Sabatini, and I am the operations manager here at the American Friends of Jamaica. It is one thing to say that we have directly served 18,000 individuals. It's another to hear them speak about how our support has changed their lives. We are pleased to welcome our guests today, which will show the diversity of our impact. Mandy Melville is the founder of Creative Language-Based Learning, a recurring AFJ grantee. We are proud to support their impactful work.
Good afternoon, everyone. All protocol observed. Being with you today is both an honor and a heartfelt privilege. Since 2019, the American Friends of Jamaica has stood shoulder to shoulder with the CLBL Foundation, not just as a donor, but as a catalyst. Your support has allowed us to transform a personal mission into a national movement. Because of AFJ, today we're working with 343 trained teachers, in addition, 35 instructional mentors at 146 schools, reaching over 5,000 students per year, many of whom were once labeled unteachable or left behind. But let me be clear, we have not outgrown AFJ. We have grown because of AFJ. Your investment allows educators at all levels, infant, primary, secondary, and special needs to effectively deliver research-based sensory cognitive instruction to the most at-risk students, specifically that using that of the program of Linda Mood Bell. Let me take you to a rural school in St. Elizabeth, Kiska Primary Infant. In February of 2024, we trained their teachers in the Linda Mood Bell programs. Over a 12-week period, children received daily targeted instructions. These weren't just any students, they were among the lowest of the lowest performers. Pre-assessment scores place them at the 5th percentile in receptive vocabulary. The normal percentile is anything between the 25th and the 75th. By June, their average jumped to the 23rd percentile, a 360% gain in just 3 months. This kind of leap would be considered extraordinary anywhere in the world. In Jamaica, it's transformational. And sometimes it's the smallest voices that really reveal the most significant truths. At a primary and infant school in St. James, a 4.5-year-old boy had already been written off by his teacher. He was usually sent outside to sit alone. But after just a few weeks, a few sessions under one of the CLBL coach's guidance, he was in the classroom, engaged, focused, and learning. That same teacher, once doubtful, later admitted, "I didn't know he could learn. I didn't know I could teach him." That's what the AFJ is funding. not just education, but the redemption of students and sometimes even the teachers themselves. In 2022, we were invited to Denham Town High School, a school of 650 students. Only 2.6% were reading at grade level, the vast majority functioning at pre-prima and prima stage. These are high school students who don't know the sounds of the letters. By January 2023, 25 CLBL trained teachers began working with 58 students. Over 34.5 hours of instructions, reading skills improved dramatically. The students' reading scores, for example, their word attack went from a grade 1.4 level to a grade 3 level, 114% increase. Word recognition went from a grade 1 to a grade 2 level. These were the type of changes we witnessed. But something else happened. Students who had been disengaged and disruptive became curious, calm, and respectful. They could access their support, other support, life skills training, cognitive behavioral therapy, and most of all, a renewed sense of self-worth. 35 of our mentors are being certified by Linda Mood Bell, with another 20 on track to start in September. For the first time, 11 of our mentors applied, and most of them so far have received recognition as master teachers and been certified, now will receive the salary of the vice principal, unlocking both leadership roles and better compensation. We hope to continue growing the program with AFJ. We are scaling substantially. This isn't a temporary fix. It's a national solution in motion, endorsed by the Ministry of Education and being integrated into Jamaica's teachers' colleges. And as we reflect on those outcomes, we must acknowledge what the research and our experience confirms. Literacy is not only an education issue, but a public health issue. At Denham Town, improved reading skills translated into reduced aggression. The principal would find herself at a police station 3-4 times a week. From that, she would end up in family court weekly. A judge eventually reached out to her a second time after the first time, asking her why is she there on a weekly basis to see him. He reached out to her to ask by the end of 2023, what's happening at your school? I don't see you anymore in my courtroom. Increased empathy and a safer school environment. Students became receptive to counseling, less likely to drop out, and more motivated to succeed. As we know, poor literacy is associated with poor health outcomes, violence, and economical vulnerability. When we teach children to read, we're teaching them to navigate life, access health services, make informed decisions, and break the cycle of generational poverty. AFJ, your early support made this possible. You didn't just fund a program, you helped spark a national transformation. As we grow, we ask you to continue walking with us, because together we're not just building a better schools, we're building a better Jamaica. Thank you very, very much.
Thank you for that powerful testimonial, Ms. Melville. I will hand over to AFJ President Wendy Hart, who will discuss the finances.
Good afternoon, everyone. I am Wendy Hart, the president of the American Friends of Jamaica. At the AFJ, we are proud of our track record of transparency and accountability. We hold our fiduciary duty to our donors to be of the utmost importance, and our work begins with raising money to support the type of programs you heard highlighted here today. We are not an endowed foundation. Every year, we look to start again, fundraising annually to support our grant making, and we look to grow, to increase donations, and build lives and communities across Jamaica. Our fiscal year end is March 31st, and this past year, the AFJ raised just over $2.5 million, a 7% increase over 2024. And we distributed nearly $1.8 million in grants, which was a 13% increase in grants made, while keeping our overhead percentage below 20%. We are proud to have consistently earned a GuideStar Gold Seal by Candid. The accountability to our donors is not just with our annual audit and our 990, which are important, but it is in the trust that donors can have in our knowledge of the local landscape and our partners on the ground. Our program analyst, Peter Gay-Price, is based in Jamaica, visits our grantees, and ensures our reports. So when the Moncures, who I believe have joined us here today, contacted us to help direct a bequest, particularly aligned with their donors' love of photography, we were able to identify a significant project at the Edna Manley School of Visual Arts to equip their photography department and create a scholarship. We can speak with organizations such as the Violence Prevention Alliance and the Child Resiliency Project about expanding their data-driven programs on addressing conflict resolution. And we are building out a youth nutrition program as we understand the budgetary challenge our partners face for this important component of their programs. We also respond to the unexpected. Last July, as Hurricane Beryl left Jamaica, we were the very first nonprofit to react to the destruction wrought by Hurricane Beryl. And then we partnered in the Building a Better Jamaica initiative led by NCB Foundation, raised over $470,000 US, which was matched by NCB Foundation for nearly $1 million of impact, working closely with Bread's Foundation and Food for the Poor Jamaica as our implementing partners. These typify our stories of impact and leverage that we seek to ensure for our donors. So now I'd like to ask Karen to speak on our path forward.
So here's a preview of where we're headed next. We will expand our healthcare outreach to include cardiac care, a growing and urgent need across the island. In the past, as Wendy mentioned, we responded to the COVID pandemic. We've continued to increase the number of handheld ultrasound devices for diagnostic care, as well as a sight-saving retinopathy mission. We plan to increase the number of underperforming schools enrolled in our STEM program, helping students tap into skills that will shape their future. The pilot project in 2024 began with 25 schools across the island. We are scaling our efforts to upskill underrepresented groups and improve job readiness with a focus on economic mobility. We have been planning for growth. We have been talking about the AFJ being at an inflection point. With your help, we want to impact more lives, more communities, and ultimately increase more beneficiaries each year. I believe I speak on behalf of my board and my team. There's nothing more fulfilling and enriching than when we present our annual grants in Jamaica each year. We're aiming to increase the impact of our annual discretionary grants, giving our major donors more tailored opportunities to support causes they are passionate about through curated grantee profiles. Please ask more on that. This work is only possible because of you, each person here today, our donors, our partners, and our champions. Your support is not just a gift. As Mandy Melville said, it is a catalyst. I will now hand over to Peter Gay-Price.
Ladies and gentlemen, the pleasure is mine to introduce Dr. the Honorable Christopher Tufton, a graduate of the University of the West Indies and Georgia State University. He received degrees in Management Studies and Marketing, respectively. He's also a graduate of the University of Manchester in the United Kingdom and holds a doctorate in Business Administration. Dr. Tufton has served our nation as the Minister of Agriculture and Fisheries and the Minister of Industry, Investment and Commerce. He's currently the Minister of Health and Wellness and Member of Parliament for West Central St. Catherine. His contributions to public service and policy continue to shape the future of Jamaica's healthcare system, reinforcing his commitment to a healthier and more resilient nation. Please give a warm welcome to the Honorable Christopher Tufta.
Okay, thank you very much. And let me begin by just recognizing the AFJ members, your primary donors, the testimonials that came in suggesting the critical work that you do. I echo all of those sentiments, and I want to also add my appreciation to AFJ for the support that they have given public health initiatives in Jamaica over the years, some of which was mentioned earlier. In 3 minutes or so, I'll give you my overview and then we'll be open to any questions. Firstly, that Jamaica's health system is a combination of public and private. In the public space, we have approximately 3 million visits to hospital and health centers each year, about 1.2 million to hospitals, 1.8 million or so to health centers. We have 320 primary healthcare or community health centers across the country, 24 hospitals. The leading cause of death in Jamaica are linked to lifestyle diseases, diabetes being the number one, cerebrovascular disease number 2, hypertension 3, and ischemic heart disease 4. Those are the 4 top causes of death, accounting for about 38% of the overall deaths. We have probably between 18 and 22,000 deaths each year. We have a hub and spoke system, which means we have referral institutions, but a big part of our emphasis, which is why we appreciated the gifts that were given last time, is the outreach into communities, where we can focus heavily on screening as part of prevention, which we do primarily in our health centers through various means, people coming in and health workers going into the community, visiting homes and conducting some of those screening, as well as serving populations that may not be mobile to move into town centers where hospitals normally are located. We have a 10-year strategic plan, which we are building out, building and expanding on hospitals now, upgrading health centers, adding more personnel, doctors and nurses. The limitations are, in some instances, it's personnel, because there's a mass migration, one-way movement of our healthcare workers, normally to the US, but also to Canada and the UK, and less than adequate numbers coming in. So training is a big issue. And beyond that, in building out these institutions, we have to equip them with equipment. And we do depend both on GOJ funding, but also on partnerships. And we have various means of promoting those partnerships. We have partnerships in terms of adopting a health center called an Adopt a Clinic program, where the diaspora plays a big role. We have about 55 health centers that have been adopted by Friends of Jamaica or Jamaicans who live in the diaspora primarily. We have partnerships through missions that come to Jamaica to provide special treatment, maybe a few hundred a year. And we have an NGO within the ministry that accommodates these missions. They may come as medical professionals who do surgeries, or just support a medical team that may go into a community or be based at a hospital to do specialized work. And then the final point is the issue of equipment, which I know you have contributed to in the past. I'm speaking this in the sectoral debates on Tuesday the 10th, and part of my intention is to advocate for greater partnership to secure cutting edge technology. We could be as sophisticated as calling it artificial intelligence type of technology that is able to be more minimal invasive, that can do more screening in communities, that can do procedures remotely, that can provide a more equipped labor force that complements humans to do some of the work that is needed to be done. And we have a few projects around that. I intend to appoint an expert group that is a link between locals and overseas experts to look at how we build out our strategic plan along the lines of engaging more technology to do the work that is necessary to treat with our population. So we are open to any ideas, suggestions. We can make information or further information available to AFJ. We normally do. And there are several possibilities where a partnership could be beneficial to the population or to segments of the population. And I'll close there and ask and respond to any questions that you may have. Thank you.
Thank you, Minister Tufton. We're going to get to questions in just a minute. We appreciate your comments and we genuinely appreciate your years of service to the country of Jamaica. Thank you. I also wanted to add my thanks to those of you who've joined the call this afternoon. We appreciate your support over the years and hope you'll continue to have AFJ in your plans, whether through annual gifts, monthly donations, or participation in one of our galas. I'm sure that the presentations this afternoon have given you some appreciation for the work done by AFJ. And also when you listen to Minister Tufton, to all of the many areas that need support going forward. As you may know, in the past, most of our grants have been distributed through a general fund where a group of AFJ directors get together and decide which charities are going to be supported. So, most of the money has been distributed historically through the general fund. Some of our donors, some of our larger donors, have asked if we could provide a program which would allow them to support a specific cause of their choice. Examples you've heard today include university scholarships, medical equipment, teacher training, and emergency response. We have some thoughts on how we can create specific causes in these historic areas of our focus. And we are delighted that to welcome Diamond Mosley as our quite new development officer. She will be reaching out to you to learn about your areas of philanthropic interest. We're anxious to hear what you're interested in, possibly cancer care or women's health or STEM education or eyeglasses for students. There's so many worthy causes that we together can support. I hope you'll take Diamond's call and you'll engage with her. We'd like to find a project that you are passionate about. Our board believes that this initiative will help expand the scope of our work in a major way. We look forward to helping you find projects that you are passionate about and to substantially increasing the good work that AFJ does in Jamaica. Thank you for your time this afternoon.
Thank you, Mr. Klotz. We're now entering the question and answer section. If you have any questions, I invite you to please write them in the chat and they will be read aloud.
Thank you, Griffin. We have an audience question here, but I believe Minister Tufton has already addressed this question. I will share it, and Minister, if you'd like to expand, we'd be happy for that. The question is, as the AFJ continues to focus its efforts for the most impact, please highlight what you see as priority areas where our partnership will have the highest impact.
Okay, thank you for that. Well, for us, a big focus is on screening and prevention, which means community-based interventions. And there are various ways to do that. We have an army of healthcare professionals who work within communities with their health centers or clinics being the base. They are qualified at different levels, from the doctors who examine patients who may go out into communities, into homes, or be based at the health center, to the community health aides who remind persons about their medication, do their blood pressure checks. All of these functions require equipment of one form or another. And we want to try to advance the tools to do that kind of work so that we can control illnesses or prevent illnesses. So anything around that would be a good priority. And then when you get to the secondary level of care, which means the hospitals, then it becomes now, how are those institutions equipped? I do know that you wanted to focus on cardiac care, and cardiac care is about really prevention in the first instance, but then of course the curative side, which is operating theaters and the tools to do that kind of work. So any of those would be perfect. I could extend that into other things like oral health, which is dentistry and vision care and so on. So depending on what your interest is, we could do a 2-pager for you within a day or two. It's such a wide area. I know that something came on the screen about a doctor clinic. So if you don't mind, Madam Chair, I could quickly elaborate on that. So this concept was developed when I became minister some years ago, which really says community health care is about community engagement. Many people grew up in Jamaica. Their first experience with a health facility is their community health facility, the clinic. And they were designed out of a system that tried to put one health center within 10 miles of every resident. So we have 300 and about 2025 or so. I mean, they keep changing yearly. And they are manned by health workers, sometimes just up to the level of a midwife, but sometimes up to the level of doctors. And they have various functions, maternal health, some curative functions and so on. So what we have done under the Adopter Clinic is to design an MOU, which is non-legally binding, but it appeals to persons who may be affectionately linked to a particular health center or are interested in the prevention side of medicine, and say to them, adopt this facility for the next 3 years in the first instance, where there's a minimum commitment of cash or kind, and it's quite limited. It's probably, I think it's about 7 or 8,000 US minimum to start with per year for 3 years. And that's really to establish a relationship. We mount a plaque on the wall of the health center to say adopted by so-and-so family, so-and-so organization. But then after that, there's a relationship with that facility. So you come back to Jamaica, you can go and visit the health center, you can interact with the staff. They'll always have additional needs, an autoclave, seating for this waiting areas, a refrigerator, a microwave, a stethoscope, things that both staff and patient needs within that facility. And we send an annual report on the performance of the facility to the adopter. So it's a relatively low barrier to entry, but once you establish a relationship, you may have to commit a little more as you go along. So, but it's a great program. We have 55 adoptions so far. We're targeting 100. So we have another 45 to go. Thank you.
Thank you for that, Minister.
Mr. Robinson asked, what is the current status of COVID in the country? I had heard there has been an outbreak recently, and I wonder how serious it is.
No, I have no official confirmation, and I would, if that was the case, that there's an outbreak. We still have the COVID virus. It's now endemic, I'm sure, to all of our populations, but it's no longer novel. So it has, the population has built up a certain level of resistance. And therefore, from time to time, we have cases. I think we have had about last year we had about 2 deaths, 2 or 3 deaths from COVID. This year, I'm not sure if we have had any so far. And it's normally linked to persons who have extreme vulnerabilities or compromised immune systems. So there's no outbreak. We treat it almost like the flu now. And if persons have symptoms, they can get a test done at a hospital and certainly get the necessary treatment where they need that treatment. Thank you.
There's a comment from Dr. Kim Scott.
Dr. Kim Scott states, not a question. Thanks so much for the support from AFJ over the years. I'm using this opportunity to advocate to our minister for also including screening for adverse childhood experiences as a priority. This is creating a huge public health crisis in chronic diseases, violence, etc. later on.
And you're absolutely right. And we are actually teaming up with the Ministry of National Security for an intervention at the level of communities by establishing a child and adolescent centers. One was recently established in Montego Bay, which is manned by healthcare workers that intervenes in communities and allows for a safe space for young people to interact, to get counseling, to get support, to do their homework. We also have another program with UNICEF that establish these centers in the town centers, normally near the bus stops where people take transportation, public transport to go home. And we actually need to establish a few more. We only have two, one in the Halfway Tree Bus Park, one in St. Thomas. We're trying to put one in each parish. And essentially it's a resource center that is equipped with computers for them to do homework, but then it's manned by personnel that provides sexual and reproductive health related advice, other forms of counseling. And we think that we have seen a great deal of success with those two. So we're now trying to team up with UNICEF to get funding to establish more of those. But I do support that we need to do more around screening and supporting our children.
And
Newborn babies, we have, through the public health system, we have a strong outreach for pregnant women up to the point of birth and in the early stages after birth. And that is the primary healthcare response to healthy delivery and the initial early life stages of those children. We have recently reformed and restructured our primary healthcare system to literally reflect a life stage approach, which is to refine how we treat with the maternal stage of early development. It's the most consistent feature of the primary healthcare system. So all the health centers provide that support, where mothers and their babies before birth and after can tend to and get advice and so on. The challenge is always to incentivize and motivate the mothers to attend to the clinic prior to giving birth. And in some instances, unfortunately, some turn up just prior to giving birth as opposed to multiple times before. There is a program that we had started, which I think exists in other countries, certainly in Europe, called the Baby Box, where we incentivize the mothers by providing them with a facility that is essentially a baby cot, but it's made in a particular way, so it's not as expensive, and we input items with each visit to support the child and the mother, and it incentivizes attendance to clinics. And that program is on a limited scale, and that's something that could also be expanded as part of the incentive.
Thank you, Minister. For the remaining 5 minutes, are there any questions for the AFJ? We have several of our board of directors here, our team. Well, as we close, I would like to invite you all to mark your calendars for our upcoming fundraiser in the fall. On October 10th, we will be hosting our annual Hummingbird Gala at the Plaza Hotel in New York City. We will be honoring Jason Hensel and Joseph Bogdanovich. So please be on the lookout for our save the date, our invitation, spread the word. If you're aware of any corporate sponsors who would like to come on board and align with us, please contact anyone on the team, Diamond, myself, and we'd be happy to start the engagement with any potential prospects. With that, I will hand over to Wendy Hart to close us out.
Thank you, everyone, for joining us. And a particular thank you to our presenters, Minister Tufton, and for taking such great questions. Mandy Melville, Jade Thomas, our director, Roddy Klotz, our executive director, Karen Chung, and our team, Diamond Mosley, Griffin Sabatini, Peter Gay Price, Liam O'Malia, and Diana Ramirez, for this focus on the work we do and for highlighting some of our programs and partners with impact. And I would also like to acknowledge our board members who have joined us today. Today, you have heard us speak about coming together in partnership, and we see this power in partnership time and time again, that working together, we can leverage networks, knowledge, funding, and impact. And whether you have joined us today as a donor, a volunteer, a foundation, charity, or a grantee, you are our partner in creating change for the future. And we are very focused on the future as we understand that the needs are great and they are always changing. In education, we need to join with those looking at how best to create a workforce for Jamaica's future, while also being focused on improving statistics for the most basic but important of skills, literacy and numeracy. So we gather information from organizations like CLBL. Karen serves on the STEM task force. We have worked with the Ministry of Education on a STEM pilot program in underperforming schools. And we need to be informed on the areas in the healthcare sector where our investment can impact health outcomes. So, as you've heard today, we have very strong relationships with the Ministry of Health, the regional health authorities, and healthcare NGOs. At the AFJ, we are investing in this commitment to the future, and we look to partner with you who have joined us today. We invite you to build our relationship, whether that's following and sharing our social media, scheduling a coffee to discuss partnership opportunities, inviting friends to learn about our work, or making a monthly commitment. Every form of engagement helps build stronger communities in Jamaica. So I'd like to thank you once more for taking the time to be with us. We know your time is your most valuable resource of all. Thank you.
Thank you, everyone.